Anyway, we're talking here to Dr. Tom Godwin, and we're going to, what's the right word? We're going to make this sort of the end of part one, and then we're going to go to part two and start over again. So that thing's counting down again. He's going to have to do some editing on this, obviously. So David Ingram, and this is part two, talking to Dr. Tom Godwin about his book called A Doctor's Notes. And we had part one where we talked about Tom's a mutual friend, the fact that we know each other because of David Hancock, and way back when, and not something you expected to talk about, Tom DeRoos. So you broke your neck twice.
Actually,
Three times. Three times. Once exiting the womb.
Oh, that's right.
Once playing a superb knockdown of the receiver of a football because you were running down the field with your arms in the
air,
ball
yeah,
missed you and you crashed into the guy that caught it.
Yes. And,
I love that
was
description.
That was a bad fracture. And then I broke another part of the same bone in a wrestling match about 3 years later. And I did some damage to my cord, probably from the football injury, but and it showed up eventually when I had an MRI. But it basically was asymptomatic and non-progressive, so I was very lucky about that one.
Well, the way you described the fact that you got up and everybody was moving you around, you went to the hospital, you went to the doctor. So let's talk about this. And we'll make this the broken neck syndrome, because you, in your book, in this first chapter, point out just how important it is. I mean, if that happened today in the typical football game, you would have been immobilized.
Oh, absolutely. Yeah.
And people would be paying attention.
That's right.
But this was back in, what, 1952 or 53 or
54.
something? 54.
Yeah.
And nobody paid an awful lot of attention. And
no, it's only when they saw the X-ray that they started to get pretty excited.
Yeah, and then they still didn't immobilize you right away. They just told you to keep your head still.
Yeah, they had an intern sitting with me,
but
so they wouldn't turn my head.
That's a lot different from immobilizing you.
Oh, yes, but I'd already survived about 3 days from the injury.
I know. Can you imagine that today?
No.
My daughter broke her neck, too, and Dr. Von Patigan, was her orthopedic surgeon.
Yeah.
And I can still remember he recommended that she put a halo brace on.
That's right. Yeah, that's probably better treatment.
Well, different than tongs.
Oh, that was what they were. Yeah, there was some
Similar.
question whether I was going to have tongs on my head like this, on a slant board, and then a weight over the end.
Yeah.
And you're like that for 3 weeks before they let you do it.
Well, a halo brace is only better than that you get out and walk around.
Well, that's a lot better than lying on a board.
But my daughter refused to have a halo brace, and she just refused to. And Dr. Van Patigan said, well, we don't like operating on young ladies because they get a big scar, right?
Okay. Yeah.
And but he did.
Yeah.
And I can still remember down at Shaughnessy is where it happened. He came out of the hospital room and he was just, he said, that was lucky, because if we hadn't operated, she'd be a quadriplegic, because it was all so bad, and little bone chips that would have just rubbed away on the spinal cord and everything. So
that would be awful.
Sometimes people know, but you seem to have come out of this amazingly well.
Oh, yes, I did. And I had a compression fracture, and that obviously did a little damage.
Well, it said it took a third or two-thirds of one-third of your
bone. Body of the vertebrae was
gone.
Was reduced, crushed in. Yeah. But it wasn't. I was unconscious, I think, transiently when the injury occurred, but it was never really painful after that. It was uncomfortable, I would say, but not painful.
Well, you had some comments in your book about you had pain in your rectum, if you put your head back, and pain.
Yeah, that's right. When I went held my head and pulled back, it felt like something was really warm or hot in my rectum. And when I went like this, pushing down with my chin and pushing up with my hands, I felt that same warm feeling in my center of my chest. Really strange. And when I told my dad about that, he said, geez, you got to go and see my friend who was a pediatric orthopedic surgeon. And that's when all the x-rays were taken at that point.
I
But
mean,
up
you
until then, I wasn't going to have anything done.
You got to be the biggest kid in the
The
in the
emerge,
kids.
yeah. I was 17, and the cutoff age, I think, is about 16 or somewhere in there. Yeah, it was sort of funny to be in a children's hospital.
Well, Art, that when you get, I mean, I've had took my hand off back here somewhere, and I took that foot off and up to my knee, my right foot, and I'm trying to remember the name of the orthopedic surgeon. I can't remember his name in North Vancouver, and he was so good. But there was another time, we got phones running across here, but we're not taking phone calls right now unless it's about this. We had my son Mitchell had a broken arm, or, well, he was complaining about his arm being hurt because it's for a week.
Yeah.
And at one point, he actually put a sling, we made him a sling, and then he came out of the bathroom with it on the wrong arm. So we figured he was just faking it.
Yeah.
And then we're outside a week later, and this is when he's like 7 years old, and we're outside, and he winces when one of his friends pulls him out of the bush, like really winces. It was obvious it was a big wince.
Yeah.
So I said, let's go down on Sunday morning. We'll go down to the emergency at Lions Hill.
Good time to go. There's not as crowded.
Well, we got there. There was like 2 people, and then we spent 6 hours there. Well, ambulance after ambulance after ambulance brought in kids from the soccer fields with arms, legs, and at least 3 of them came in and full immobilization with possible broken necks or something or other. And the x-ray technician, because our arm was a week old, of course, the triage, everybody else got looked after first. And then it was like being at Lourdes, like 5 hours later, because I can't remember his name, and he was such a good orthopedist. Anyway, it doesn't matter. He comes in the room, and he got this long bunch of stuff, and he says, so-and-so, you're okay, you can go home. So it's like Lourdes, all these guys that are lying there like this, and their mother's there, and their father's there, and everybody's worrying about whether this, and I've been there, there, but I know their feeling, right, what's going to happen. And he's saying, you're okay, and this swarthy guy gets up, just rises from the cot where he's being kept and immobilized for 4 hours or 3 hours, and they all get up and go away, and he looks around this now empty room, and he says, Mitchell Ingram, he says, you have a broken arm. So we got to go into the cast room.
Yeah, and he was the only guy that...
He was the only one that had a real injury, and his was a week old.
Yeah.
So...
And he looked like the healthiest.
and I understand, and you as a doctor must have been able to use the way you were treated and the lack of attention. Yeah. Did it change your attitude towards...
Oh, it probably did. But your experiences all add up, and I certainly know you have to be careful. You can't just be flippant about a diagnosis. And with chest pain, because I saw so many people with chest pain, you can't just say, oh, that's indigestion, or that's heartburn, or, esophagitis or something. Chest pain can be important. You have to ask all the questions, Like, does it get worse when you climb a hill?
Again, I don't want my interview. I came home and I was diagnosed with congestive heart failure, but we'll talk about that some other time.